Hello everyone. Today we will discuss about cretinism and myxedema. What is cretinism? Hypothyroid children before birth, or since birth, they are labeled as cretins. Cretinism, it can also be referred to as infantile hypothyroidism. So there is reduced level of thyroid hormones in infants. It can lead to these clinical features that are listed over here. So the patient will suffer from mental retardation, growth retardation, protruding tongue, pot belly, along with delayed milestones of development, and there will be no secondary sexual characters. We had discussed about this term when I was talking about dwarfism, hypothyroid dwarf. So we can see here growth retardation, mental retardation. That's how it was differing from pituitary dwarf. So how the condition of cretinism is treated? If there is deficiency of iodine, we have to administer iodine in diet, and synthetic form of T4, that is levothyroxine. It can also be very much beneficial. You can see the picture of a patient suffering from cretinism here. You can see dwarfism. You can see poorly developed breast, lack of secondary sexual characters, protruding abdomen. Now about myxedema. Myxedema is adult hypothyroidism. Whenever there is reduction in the levels of thyroid hormones in adults, the condition is labeled as myxedema. In myxedema, there is infiltration of the skin by myxedematous tissue. As you can see from this figure, there is presence of skin infiltration by myxedematous tissue. There is non-pitting edema, we can say. Over here, you can see here. Periorbital edema. Puffy, dull face with dry skin. Face appears to be very much puffy. First symptom is non-pitting edema. Very important point to note here is non-pitting. Markedly seen over the skin of hands, feet and eyelid. Periorbital swelling. It can also be seen in this figure. Periorbital edema. Here also. Now what is the reason to this? Very, very important reasoning based question. Very important reasoning based question. Answer will be delivered in the reasoning based question session. Person may suffer from increase in sleep, lethargy, decrease in heart rate, decrease in cardiac output. Features are reversed from Graves' disease. In that case, there was tachycardia, increase in cardiac output. Here it is bradycardia, decrease in cardiac output. BMR will be decreased. In Graves' disease, it was increased poor tolerance towards heat. Here it is poor tolerance towards cold. Speech is very husky and slow. Movements are very slow. Memory is poor. Mentation is slow. Reflexes get reduced. Dry skin occurs, and there is typical toad type skin. Carotenemia may occur. Skin appears to be very dry and yellowish. Constipation, menorrhagia, infertility. These are the clinical features seen in the patient suffering from myxedema. Now, how do we treat the condition? By treating the underlying cause, whatever it may be, administering T3, T4 or giving levothyroxine. You can see the symptoms of myxedema here. Just have a look over the figure and try to memorize it. You can write in the exam, you can reproduce in the exam.